The hip is a ball and socket joint that connects the thigh bone to the pelvis. The rounded head of the femur fits securely into a cup-shaped socket called the acetabulum. This design allows the leg to move freely in many directions, including rotation. The surfaces of the bones are covered with a smooth layer of cartilage. This cartilage acts like a cushion, protecting the bones, reducing friction, and allowing the joint to move smoothly. Hip osteoarthritis develops when this protective cartilage gradually breaks down due to long-term wear and tear. As the cartilage becomes thinner and eventually wears away, the bones can begin rubbing directly against each other. This can damage the joint and lead to the formation of bone spurs, which are small bony growths. When severe arthritis causes persistent pain and significant loss of movement, total hip replacement surgery may be recommended. During the procedure, the damaged parts of the hip joint are removed and replaced with artificial components designed to restore movement and reduce pain.